Good evening and thank you for coming. We, along with our partners at Kerr County, Peterson Health, the Kerrville Independent School District, Schreiner University, Kerrville Public Utility Board, and the Chamber of Commerce, appreciate your interest in the health of the citizens of our city. We have representatives from the city, county, and Peterson Health here to take questions. These are trying times for Kerrville, our nation, and the world. We are faced with a new virus that just a few months ago no one had heard of, and we are doing all our best to navigate the best path forward in dealing with it. COVID-19 represents a health threat to all of us, but most particularly to a population that makes up a large and vital part of Kerrville, our seniors, including me. While we have had no cases of COVID-19 reported locally, the threat that it represents to us, a threat that has been borne out by sobering statistics from COVID cases across the country and around the world, demands that we do everything possible to try and slow the virus's growth rate. Toward that goal, today I am issuing a declaration of a disaster in accordance with Section 418.018A of the Texas Government Code to take effect for the next 7 days, which can be renewed as needed by the Kerrville City Council. This declaration activates the city's emergency management plan, which includes management of medical and health emergencies. So what will the city do pursuant to this plan? Better publicize local efforts to combat COVID-19. We are standing up a joint operations center in partnership with the county, Peterson, KISD, and Schreiner that can answer or direct questions from our citizens to the latest local information regarding the virus. Beginning tomorrow morning at 8 o'clock, residents can contact the center at 258-1111. 258-1111, Monday through Friday from 8 a.m. to 5 p.m. We also have a dedicated City of Kerrville website page at www.kerrvilletx.gov that will be updated as often as necessary to keep citizens aware of the latest local developments regarding COVID-19. We are recommending the Center for Disease Control and Prevention's large events and mass gatherings guidelines, which currently call for canceling or postponing in-person events that consist of 50 people or more until further notice. It must be noted that this is a fluid situation and we will adapt to the CDC changes accordingly. All City of Kerrville Advisory Board meetings are canceled, as well as Parks and Recreation and library activities. The library will close tonight, but offer curbside service beginning tomorrow and running Monday through Friday from 10 a.m. to 6 p.m. We want to remind citizens that the library can be accessed online on the city's website, and we encourage people to do so if possible. Next Tuesday's City Council meeting will take place, but again, access to the council chamber will be limited to no more than 50 people. We encourage our citizens to follow the meeting online at the City of Kerrville website. The city's utility billing office will remain open, but citizens are encouraged to pay online, over the phone, or through the drive-thru. Our development community is encouraged to utilize our online permitting software via our website as well. We are not calling for area businesses to close. We are very aware of the impact the economic downturn caused by the COVID-19 is having on local businesses. But we do encourage those businesses to explore ways to adapt to the current environment that will promote social distancing in an effort to protect not only their patrons, but also our vulnerable senior population. Before I turn this over to other partners for additional comments, Let me address a topic I have referred to numerous times before, which is Kerrville kindness. Our city being known for kindness. This is such a time for kindness. I want to applaud the efforts of our local Peterson healthcare professionals in dealing with increased demands brought on by COVID-19 inquiries, and for our local merchants, especially at H-E-B and Walmart, who have made outstanding efforts to keep up with the demands placed on them for goods and services in recent weeks. I also implore our citizens to recognize that we are all in this together. When you go to the grocery stores and the pharmacies, the hardware stores, shop as you always do, rather than as if the world is ending. Hoarding of supplies robs others of needed items and is out of character for the kind of Kerrville I believe that we want to live in. Some might think we are overreacting. Instead, we intend prudent preparation. I have faith that we are a caring community. If you are young, your chances of surviving a COVID infection are outstanding, but you still have an obligation to try and protect those who are more vulnerable to this virus. Please remember the basics. Wash your hands, cover coughs and sneezes, use hand sanitizer that contains at least 60% alcohol, avoid touching your eyes, nose, and mouth, avoid close contact with people who are sick, put distance between yourself and other people, and stay home if you are sick. Now, let's hear from Chief Danny Smith of the Kerrville Fire Department, followed by Corey Edmondson, CEO of Peterson Health.
Thank you, Mayor, and good afternoon. As the Mayor has stated, I'm Danny Smith, Fire Chief here in the city of Kerrville. And there are three areas that I want to discuss with you for the next few minutes. First, we're all aware of the seriousness of COVID-19 and the impact that it's having on the world. So to start, I want to provide a snapshot of the confirmed cases and total deaths that the CDC and Johns Hopkins University Coronavirus Resource Center is reporting in the world. Secondly, I want to share with you the steps our city is taking to ensure the public is provided current information and taking the necessary steps to protect our community as outlined in our city's emergency operations plan. Finally, I want to commend those in our community who have heeded the warnings of the CDC and the city of Kerrville and done their part to slow or stop the spread of COVID-19. So let's start with what the COVID-19 numbers look like in the world. As of noon today, Johns Hopkins University Coronavirus Resource Center and the CDC are reporting that there have been 179,073 confirmed cases in the world, which has resulted in a total of 7,074 deaths. In the U.S., the numbers are 4,138 confirmed cases and 71 total deaths. And then for the state of Texas, there's been 57 confirmed cases and no deaths. So I would like to reemphasize that as of today, there are no COVID-19 cases that have been reported, and we are not aware of any known COVID-19 cases in the city of Kerrville or Kerr County. However, we can't get comfortable and let our guards down and believe that we're completely out of harm's way. Second, I want to talk to you a little about what the city of Kerrville has done and when it began its planning in response to COVID-19, which started in the early stages of notification that cases were being identified in the U.S. On January 24th, 2020, we began taking the following steps. First, we assembled a subcommittee of representatives from Peterson Regional Medical Center, the city of Kerrville, and Kerr County to monitor COVID-19 and its status in the U.S. and the world through public health reports. Secondly, since that time, we have held weekly, which have now turned into daily conference calls with local and state public health officials and representatives to receive and implement the latest precautionary and protection recommendations. Third, our communications and dispatch call takers were directed to ask key questions to limit exposure of our first responders. So if necessary, they could don the proper personal protective equipment and provide the needed treatment and transportation. Fourth, we have distributed and posted CDC educational and training materials for city employees in the community to raise the awareness of COVID-19. Fifth, we are working to identify critical functions that will continue and non-critical functions which will be temporarily suspended in the event there's a COVID-19 outbreak in Kerrville and Kerr County. Six, it's our hope that we don't have to implement any of this and COVID-19 is contained soon. However, in the event it is not, we're developing a plan to continue to deliver critical services if a substantial portion of our workforce is impacted by this virus. Finally, we're working to identify backup resources in the event the city's supply chain is interrupted. Now, I want to reemphasize something that the mayor has said. COVID-19 represents a health threat to all of us. In addition to the following basics the mayor has provided to you, I'm asking you, we're recommending, we're encouraging, we're begging, please practice the art of social distancing. Social distancing is a term that covers what people do to maintain some space between themselves and others. And the CDC recommends a space of 6 feet. You can find some great information regarding COVID-19 on the city's website, which also contains links to critical information provided by the CDC. You will also find a comprehensive list of the most frequently asked questions regarding COVID-19. So finally, I want to close by commending those in our community who have heeded the warnings of the CDC and the city of Kerrville and done their part to slow or stop the spread of COVID-19. And with that, I provide the following examples of some of our community partners. Chick-fil-A closed dine-in service and is only allowing drive-through. HEB has changed the store hours from 8 a.m., changed their store hours from 8 a.m. to 8 p.m. Walmart changed their hours from 6 a.m. to 11 p.m. Kerr County Jail suspended visitation until further notice. Peterson Regional Medical Center has implemented screening and restrictions for visitors. The Hill Country Youth Soccer Association has postponed the season until further notice. Little League is waiting for a decision, which I think they have now, regarding from the Commissioner's Court on the future of their season. Our local churches are implementing social distancing policies. Notre Dame School has, at the direction of the Archdiocese of San Antonio, has closed until April 3rd. Our Lady of the Hills has also delayed the return of their school after spring break. KISD is going to make a decision on Thursday, the 19th. Shriner University will open after spring break, but are making internal modifications, and the diner is closed to the public. Starbucks has removed all the chairs and all the condiments behind the counter in response to mass gathering recommendations. The Dietert Center has canceled all functions, but the Meal on Wheels program will continue. And then finally, Playhouse 2000 has canceled a scheduled performance this Saturday, which I think is titled Celtic Angels Ireland. So with that, that's just kind of an overview of what we're doing, the protective actions we're taking here in the city of Kerrville. And with that, I will turn it over to the representative from Peterson, Corey Edmondson.
Thank you, Chief, Mayor, City Manager, for hosting this today. I think it's important for us to communicate community-wide what we're doing as a community. And I say that, emphasize that, of what we need to do for the community. Peterson Health, for the last several weeks, has been meeting regularly to develop and plan for the future for our health system and for the community. We have set up our hospital incident command system that's meeting daily to develop plans for our future and for the future of Kerrville and how we're going to care for patients and development in regards to that. That's changing almost hourly and certainly daily as to what we do. In fact, we met this morning, had a plan, and met again this afternoon, and it changed completely based on new information that we had. We have to learn to be adaptable, nimble as a community, as an organization, in order to be able to weather the storm for this whole event with COVID-19. So Peterson as a whole, our goal is to protect the citizens, our patients, and our staff and visitors that come to the hospital. We need to preserve a precious resource in our community, and that's the health system. So I'll read to you some things that we are doing now and that we are implementing effective tomorrow. So bear with me here. Despite having no confirmed cases of COVID-19 in KERR or surrounding areas, Peterson Health has elevated efforts to protect patients, visitors, and the general community. Effective tomorrow, Peterson Health is putting changes in place to protect those in our community. Visitations at Peterson Regional Medical Center and all Peterson Health medical facilities will be limited to 2 visitors per patient, 1 at a time per day. A few exceptions will be considered as determined by healthcare administrators. This new restriction will help us minimize the risk of any potential spreading of COVID-19 in our community. Entrance to Peterson Regional Medical Center and the emergency department and other medical facilities will be limited. Patients and visitors arriving at our facilities will be directed by signage to the main entrance and the emergency department main entrance as well. Children under the age of 16 will not be allowed in the hospital. All visitors entering Peterson Health facilities will be screened for COVID-19 7 days a week. Screenings consist of brief questions, general questions as outlined by CDC, to include recent travel history and symptoms they are experiencing, such as fever or respiratory issues. Temperatures of visitors will be taken. Patients with COVID-19 have reportedly had mild to severe respiratory illnesses with symptoms of fever, cough, shortness of breath. If you believe you have been exposed or are experiencing these symptoms, Peterson Health encourages you to self-isolate and call your primary care physician or call Peterson Urgent Care at 258-7669 before coming into the facility. This allows Kerrville to keep its most precious assets, the hospital and the emergency department, open and available at all times. Peterson Health has established a COVID-19 hotline for non-medical questions and for answers to most frequently asked questions. That number is 896-4200. That's manned by a registered nurse and is open from 8 to 5, Monday through Friday. When you call the hospital number, you'll select 1 as the option, and you will go to our nurse that answers the phone. In addition, Peterson Health continues to add current news updates, resources, and community education to the website at www.petersonhealth.com to include daily updated 1-minute medical messages on COVID-19. Peterson Health continues to work daily with local first responders, specifically EMS, and stay in close communication with valued community partners to include the City of Kerrville, Kerr County, local law enforcement, local school districts to share resources and to keep the lines of communication open and consistent. Pam Burton, Infection Prevention RN for Peterson Health, reminds the public to take these steps to help prevent the spread of the illness and potential for COVID-19. You've heard this before, and we can't emphasize this enough, but wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, use alcohol-based hand sanitizer with at least 60% alcohol. Avoid touching your eyes, nose, mouth, especially with unwashed hands. Avoid close contact with people who are showing symptoms of illness. Clean and disinfect frequently touched objects and surfaces. Cover your cough and sneezes with a tissue or sneeze into your elbow. Throw the tissue in the garbage and make sure you clean your hands afterwards. Stay home when you are sick. Peterson Health will continue to monitor and collect all resources from the American Hospital Association, the Center for Disease Control, the Texas Department of State Health Services, and other hospitals and health organizations, and work closely with KERR area health partners to help keep the public updated and informed. More information and updates on Peterson's preparedness, contact any of the following personnel: our infection prevention, Pam Burton, at 258-7448, or with communications, Lisa Winters, our Director of Marketing and Community Relations, at 258-7628. I leave you with this one last comment, that Peterson Health is here to help the community. We are currently fully operational. We have not shut down anything, and we'll manage that and balance that based on the needs of the community and what the general public and what the nation is experiencing as a whole. We need to balance that with our daily lives, what we're doing with staff, what is available, and what the expertise and what the clinical experts are telling us as a whole. We have clinical experts at our hospital, both doctors and nurses, who we'll collaborate with to determine what those needs are. But our goal is to stay open and available as much as we can, as often as we can, until we must and have to pull back on services. We don't want to do that, but that may be the case, and you as a community will know that as time comes. Thank you.
Okay, we're going to receive questions. However, first, I listened carefully to Chief Smith, and we need to do 6 feet between everybody back here.
We're not setting a good example.
No. 6 feet in terms of social distancing. All right. What questions do you have? Lewis.
First question for Corey. What is you're seeing in other hospitals, but the backup for the ICU, and how many beds are in the ICU currently?
So we have 12 beds fully furnished. We have the ability to expand if needed. That will be on a by equipment basis on whether we can expand services or not, but we have 12 ICU beds. We have 3 negative pressure rooms, 2 in the inpatient and 1 in the emergency department.
Should you have an issue, is there a plan to relocate those facilities elsewhere inside the hospital, or do a temporary type situation, or?
Talk about it in a surge capacity situation.
Yeah, right.
We are working on a surge capacity plan as we speak, and we do have some things in place, yes.
Today the president said that he recommended, the White House and the CDC were recommending, or the White House is recommending less than 10 people. I don't know who wants to respond to that. So as being a part of the group, so it just shows you how fast it changes, I guess.
It does.
Right, it's a fluid situation, as the mayor said, and so we'll evaluate it on a regular basis. That's one of the reasons we have the EOC open beginning tomorrow morning to begin sharing information. But the CDC has not said that yet, so it could be that that number changes for us and what we ask for people to do. But right now, we're at 50 is our recommendation. And just understand that this is a very fluid situation, so that could change.
The other thing that President Trump today said that it could be July or August before he thought that we would be through this. Any reaction to that?
Who wants to react?
I don't know exactly how to respond to that, but everything that we're hearing coming from the professionals and the healthcare industry is nobody knows when we'll be out of it. So the information, Corey, you may want to expound on this some, but it could be anywhere from a year to 18 months before a vaccine is developed for COVID-19.
And in this EOC that you're talking about, is this a unified command type situation? Is there somebody physically in charge of this facility?
Yes, it is. It's a joint operations center that has been assembled with the city, the county, and PRMC. and it's being managed by the City of Kerrville's Emergency Management Coordinator, which is Jeremy Hughes. Raise your hand for us, Jeremy.
Yeah, there you go.
2 Rs.
Yes, sir.
All right, does anyone else have a question?
Oh, I'm not done yet. We're not done yet. Go
Uh,
on.
I was wondering, is this going to have any effect on the local city council election?
Do you want to answer that?
It could. So we're doing all sorts of planning about how that might happen. We'll have to take a lot of direction from the state. You know, cities are creatures of the state, so they'll tell us what we can and cannot do. So there'll be backup plans developed. We're not the only city in Texas that'll be having an election in May, or counties that'll have elections in November. So we'll be developing alternate plans. For example, on a similar front, we're trying to figure out how we're going to hold council meetings, right? So we may go to an electronic version if we need to, but we'll have options and backup plans that we are developing. We're spending pretty much all our day on, like everybody else in this room, on COVID-19 because it's not something that we've experienced before, but we've got a plan, and it's a flexible plan, and as information comes out, then we'll be developing options and backup plans.
This would be a question for, I guess, the school district for Mark. The UIL locked down all practices for sports. Looks like the sports season's over. A lot of our readers keep asking us, like, when are you going to make a decision? We've heard Thursday, but can you confirm that you're going to make a decision about the end of the school year? And then the Texas Education Agency said that he thought it would be the end of that the school year might not even continue.
So, to be specific about the UIL, they've sent out 2 communications. They set a time period of March 16th to March 29th for no activities, no games, no practices, etc. So, they haven't given us any guidance beyond March 29th, but to be specific, that was the date there, and they're considering this fluid situation as well. We have been working on our response and taking a number of steps on COVID-19 for really weeks as a school district. We committed prior to going on spring break to giving our next formal update on Thursday. So we'll keep that commitment, and hopefully by the end of business on Thursday, we'll let the community know and our staff and students what our next steps are.
Cool. Thank you, Mark. Bill, what are you doing? I guess maybe this is a question for the county judge. With other communities in Kerr County, are they included in this operation, or?
Yes, they are. The emergency management person for the county has been meeting for weeks with the other entities, city, Sid Peterson, Shriner, and so that has been vital to our planning, that we are unified in this.
Does the disaster declaration put Kerrville in position for any kind of funding from the state or federal government?
At this time, it has not been declared a federal disaster. If at that time it is, and there's funds allocated for it, then yes, we've been instructed to track all the time and resources we're committing to COVID-19, and if it's a federal declaration, it will become reimbursable at that time.
Okay, thank you for coming, and I think you've heard that there are plenty of sources of good information that are available to all of us. And once again, I think all of us are pointing folks toward the CDC information as being the most solid and helpful, and so you'll see that on websites of pretty much everyone up here. Thank you very much.